If you are concerned at all about the chemicals in chemical-based sunscreen, wear a mineral-based sunscreen and or use physical barrier. And if you're somebody who just doesn't believe that sunscreens are safe whatsoever, well, as far as I know, it's a free world. You don't have to wear sunscreen, but then I would say you need to be very aware of the fact that sun can induce the appearance of accelerated aging in the skin, right? That's an actual process that takes place. There's really no debating that, frankly. And sun exposure can potentially accelerate or even give rise to certain skin cancers, and nobody wants that. Okay, before we move on to a discussion about what can be done to increase the youthfulness of our skin or the appearance of youthfulness in our skin, we need to have a bit more discussion about skin cancers. Notice I said skin cancers, plural, because there are many different forms of skin cancer. Some of them relate to sun exposure, as we discussed earlier. Others do not. And in fact, some of the more deadly skin cancers are independent of sun exposure. They can relate to genetics and to other factors. So the most straightforward story about all of this is that approximately 80 to 90% of melanomas, which are skin cancers, and they are very serious skin cancers that can indeed be very deadly, arise in what's called de novo skin. De novo skin is non-mole skin. Now, does that mean that you should not pay attention to the shape and any changes in your moles? No, you absolutely should. But for people who have naturally darker pigmentation everywhere or who have very few moles, then you aren't going to be able to use the monitoring of your moles as the only readout of potential development of skin cancer. And frankly, everybody should be thinking about these more serious skin cancers independent of moles or changes in moles. Here are a couple things that everyone should pay attention to. If you have a pimple-like lesion or you have any kind of spot on your skin that seems like it's an acne that's lasted more than a month, or you have an area that's seeping, something that might look like plasma or pus or blood, and it persists over a long period of time, like a month or more, absolutely get that checked out by a dermatologist, okay? Don't wait any longer than a month. Get it checked out. In addition, it's highly recommended that you go in and you get your moles checked by a dermatologist, and frankly, that you get all of your skin checked by a dermatologist at least once per year. This is going to really protect you against both the sun-induced skin cancers and other forms of skin cancer. The most common form of sun exposure-induced cancers are basal cell carcinomas